Welcome to this month's Minute with Victor, where Dr. Cotton answers your questions.
This month's question comes from a physician who writes, "The video on your website begins with a young woman posing a question about black box warnings. It's a good question, but no one gives the answer. Could you explain the medical legal implications of using a drug that has a black box warning?" Let me start by saying that our choice of words on that particular question was slightly incorrect. It's officially known as a boxed warning. Everyone calls it a black box warning, so that's the way we worded the question, but it's not actually a black box, it's just a box. And that's important because most of the legal concerns disappear once you stop calling it a black box. Black boxes are bad things. That's what they look for when a plane crashes. So you certainly don't want to see one associated with patient care. But this isn't a black box, it's just a box. Now, what does it mean? According to the FDA, boxed warnings have one purpose, and here it is: to highlight serious adverse reactions that can be prevented by appropriate use. To highlight serious adverse reactions, that's the purpose. The box is just a highlight. It's a way of drawing your attention to something. But in terms of how we take care of the patient, the box has no medical significance and it has no legal significance. And that's the way it should be because it's just a box. Now, what's inside the box, that's important. If it says there's a 10% risk of liver failure, we certainly need to know that and factor it into our decision. But our decision doesn't depend on whether the 10% is written in a box. Liver failure's liver failure, box or no box. From a medical legal perspective, the best way to handle boxed warnings is to simply ignore the box because, as with many things in life, it's not the color of the box, but rather what's inside that matters. Thanks again for listening.